So my name is Nicole Eid. I'm a certified cognitive behavioral therapist. I work individually with adults in individual settings, and I'm also an associate at Private Therapy App platform. I have been working for the last 20 years in this domain. I work mostly online because now with COVID, and then even before, I found out that online gave more flexibility to people. And because people move around a lot, and this would allow them not to have to stop therapy when they are not close to their therapist, or not to have to change therapist. So this safe place will always be preserved wherever they are. So it would help with people who move around. My area of expertise is mostly, I work a lot with anxiety-related issues, anxiety as in general anxiety, social anxiety, obsessive compulsive disorders. I also work a lot with personalities, anxious personalities like avoidant, dependent, or or the personalities that are triggered by anxiety. CBT is a very good tool, has been proven to be a very good tool to deal with anxiety, because what we do with CBT is that the person that suffers from the anxiety learns to expose herself or himself to the source of anxiety. And we know that anxiety, I like to compare it to like a muscle that you train. So the more you expose yourself, the more you train it, the stronger you become. And that is like the person who underestimates herself and overestimates the threat, that with time, by getting closer to the task or to the threat, starts to see her or his strength, and the threat takes a more realistic size. So the closer we get to exposing ourselves to what scares us, the stronger we feel. And this creates also a memory of success. We just pair the experience with the success. So doing it again becomes easier. And what the therapist helps the client do is to work on the faulty cognitions that are triggered and the cognitions that trigger the anxiety. So once you work on the cognitions, which is the thought process, the emotion gets better. The faulty cognition that the person, each one of us brings with his or her life experience, preset things, or what we call a core belief, something that the person believes deeply. But most of the time, with time, we are stronger and the obstacles are not the same, but we still deal with our life as if we were with the past experiences. So what the therapist does is that he helps the client work with these faulty beliefs and make them more functional. So the first session is a session where, first of all, we meet. We just meet, we see each other or we hear each other. And then the first session, I listen to what is making the client suffer or what's not happy in the person's life. And then I educate, or I psychoeducate the person about what is happening to him or to herself. If a person is anxious, I explain how anxiety works and how what feeds on the anxiety and what can make it better. And I also tell people about CBT, how CBT functions, because the more we know what to expect, the less anxiety provoking the session is. So once they know what to expect, they feel more at ease. So the next session feels a little bit lighter. And it's also, the first session is useful because we need to know if we are a good fit, if I can help the person, and if the person is comfortable with me. Because you can be with the biggest, very knowledgeable people, but there is chemistry. Sometimes, something doesn't function. So the first session allows us to see this or to evaluate this. And one very important thing that we do during the first session is setting goals. The person comes and tells me what the problem is, and we together put on goals for therapy, goals that we go back to every few sessions to just check where we are at, and we see, okay, we did this, what we still have to work a little bit on this I'm completely better with it, and so on and so forth. So it encourages a lot the client, because the client can see the evolution. So this also is very helpful. And then, we put we put the frame of therapy, like the timing, the conditions, because therapy has to be has rules, and we have to follow on them, because sometimes people will want to miss a session because they will be avoiding something that's uncomfortable. We spoke about the session before. If the next session is like set and it's on a regular basis, it will help the person to face her anxiety or her fear or whatever we're talking about. The method that I apply with my client is mostly dictated by the issue they are struggling with. So having been trained at the Beck Institute, I apply mostly cognitive behavioral therapy because it has been proven to be a technique of choice for anxiety, depression, panic attacks, phobias, a lot of issues. And it helps the client identify and change the dysfunctional thoughts, the thought patterns and the cognitions that affect their behavior and that affect their emotions. So it is a short-term, cognitive behavioral therapy are kind of shorter-term therapies, and they equip the client with tools. And at the end of therapy, in fact, what I like to see is that the client becomes his own therapist, because when he or she feels a sudden change in the mood, they learn how to go back to the cognition and say, okay, what's wrong? Why did I feel this? And to correct the cognition, and the emotion gets better. So with time, they learn how to identify and to take care of the faulty cognition. So this is very helpful long after you finish. In fact, all therapies are helpful long after you finish. But this is like you end up with a toolbox that you take with you, you take home with you. I also I might use a little bit of psychodynamic therapy or psychodynamic. I can hear in a psychodynamic way, because in fact, I had a cognitive behavioral therapy on myself when I started to work. And then I wanted to go deeper, and I went on through psychodynamic, which is a very long-term therapy. And this is why the way I hear is a little bit maybe I can feel dynamics or patterns that we sometimes don't see directly when the person is in front of us. I also use motivational interviewing tools from this motivational interviewing, which is a tool that's very helpful for addiction or for taking when we are not being able to take a decision in something. I also think that equipping a person with assertiveness training is very important, because once you're assertive, you feel stronger. So when you're stronger, you're less depressed, you're less anxious, and the world feels more like a less dangerous place. A good practitioner, of course, has to have the knowledge. I mean, he has to have the training. He has to have the what it takes, the knowledge, basically. And I have a 20 years experience. And I like to say that many stories ended up with the success, like things worked with people. And so I like to, of course, I keep on moving, I keep on learning, But many of the methods I apply, I see that they are working. People move on, people progress. Of course, we are always work in progress, but people become more functional and happier with their lives. What makes me a little bit different is the fact that I was exposed to many cultures. I lived in Europe, I lived in Canada, I lived in the Middle East. So I am sensitive to the people who change cultures, who go from a place to the other. I'm very sensitive. I can understand expats, understand the people who doesn't live at home. And I speak fluently 3 languages. I speak fluently English, French, and Arabic. So this also might help. Maybe also it gives me a more flexible mind. Like I feel that I can, move. It's a kind of flexibility and acceptance of the differences. So maybe it makes me more tolerant. Yes, I have had a personal therapy. When I started my training at the Beck Institute, I had a personal therapy in CBT, a CBT-oriented personal therapy. So it made me deal with my here and now, with my present. And with time, I wanted to know more. So I had a full psychodynamic therapy. I had the psychoanalysis on the couch, the whole thing, and I learned a lot. And it made me understand things that with CBT that would stop at the here and now with CBT, and that made me able to hear other things or to understand other things. There is this transference that happens in all therapies, but even more with psychoanalysis. That is the relationship between the therapist and the client. And what happens in the room between the therapist and the client is, in fact, what happens outside between the client and the world. So the client experiences it in a safe place, and we work on it in this safe place. So the client is more aware of him dealing with it outside this safe place, meaning in the world.